This week, Broward County became the nation's epicenter of hospital admissions for COVID, a grim distinction. Miami-Dade is running third.
South Florida hospitals generally report resources holding. Staffing is the more pressing concern. Aventura Hospital is right there in the northeast corner of Miami-Dade at the county line with Broward. Dr. Trish Stephens is the chief medical officer there and joins us live. Dr. Stephens, great to have you with us.
Welcome, Dr.
Thank
Stephens.
you for having me.
Give us a report, if you would. As it happens, Aventura Hospital is my neighborhood hospital. I've been there. I know you do good work there. Give us the report on COVID patients today. Are you jammed? Are you busy? Or do you have space?
The entire south of Miami and Broward Dade market, as you know, experienced a surge in COVID admission, and that impact the entire operations of all the hospital in the surrounding community. So Aventura Hospital experienced the same surge and impact that the rest of the hospital have experienced. We have a large number of COVID patients admitted to our hospital, and the impact is mostly felt with the ICU admission, which has upticked to 2% this past week. Same with patient needing ventilation support.
Dr. Stephens, the rest of our program, not sure if you were able to hear, but we've been talking to the Broward superintendent of schools and a couple of the board members. During that conversation, they reiterated what we learned on Friday, that in Broward County, the pediatric ICU beds are full, 100% full. I guess my question to you is, put that into context. COVID, non-COVID, any more of a percentage of pediatric cases that you're seeing besides the norm of the pandemic? And what does that mean for the upcoming school year?
Nationally, there is a 4% increase in COVID ICU, and also for pediatric, 4% increase in pediatric needing positive ventilation support that go from bypass to full intubations. So it is causing a huge impact, and this impact was not felt by the regular strain. The Delta variant is what's responsible for this impact on children that we see right now with the surge nationally, and especially the epicenter at Broward County, Miami-Dade, and South Florida. The landscape seemed to be gravitating toward human beings who are not vaccinated, and for those unfortunately unable to vaccinate because they're below 12 years old.
We've heard that from the very beginning of this surge from all over South Florida and the country, and I think what we've been hearing, hospitals that we've had with us as guests reporting anywhere between 95% to 98% unvaccinated patients. Is that what you're seeing in Aventura?
Yes, that is what we're seeing. And also there's a difference between testing positive and hospitalization. For testing positive, you see about 95% of people who test positive are unvaccinated. For hospitalization, you see 99% of hospitalized patients are unvaccinated. And the one in ICU, they are fully unvaccinated, 100%. And here's a statistic that everybody should know. The positivity rates for testing is 20% ongoing for 3 weeks now. Of those that's being hospitalized, 25% of them end up in ICU, and 13% of them do not make it out of the ICU. So the impact is huge, and that's a huge loss to the community if you should get COVID and end up in the hospital and the ICU. The message out there is vaccinations really shift the landscape of the pandemic, even prior to the Delta variant. And it is even more impactful now with the Delta variant. Yes, we do see breakthrough infections. However, if you do get infected and you've been vaccinated, your chance of getting in the hospital is very slim. The Pfizer vaccine research has proven to be 80% effective against the Delta variant. So it saved lives. The urge out there is, if you are qualified to be vaccinated, please do get vaccinated.
Yeah. Dr. Stephens, let me ask you about your staff. We have talked over the last several months to physicians, all over South Florida, hospital administrators, and we have heard time and again, our staff is burned out. The emotional toll of dealing with death and with this terrible illness is just, awful. What about your staff? What do you do to help them try to get through the psychic trauma of dealing with death and with people who are so sick?
Thank you for asking the question. That is at the forefront of our mind as well, along with the physician, the nursing staff. This strain is acutely felt in the frontline workers. This is the fourth wave out of COVID. HCA, thankfully, provide free access to unlimited phone support. It's 24/7 and 365 via nurse care. When you do call the phone, you get the advice from psychologist, social worker. Also, there's marriage and family counseling because it does bleed into your family life and your social life. We also have program include access to free face-to-face counseling. East Florida, particularly, have been well supported to take care of our staff emotional needs. Along this crisis, we have a director of pastoral care, Father Gabriel Gamnoon, who's a PhD in psychology. He has been rounding on the wards and the frontline worker in the ICU and in the COVID cohort units throughout East Florida. And several meetings have been had in terms of blessing our workers and supporting them emotionally to get through the crisis here with the fourth wave of the pandemic, the Delta variant. We also have the nurse care line, and we also have the employee assistance program that is free to all the staff and the employee who work for HCA. We do town hall weekly, and we have daily huddle, COVID huddle with the emotional support for our staff. We care so much for our healthcare worker. We also care for the community, but this is a crisis. This is the pandemic that will take both healthcare worker and community coming together to support each other and to put an end to this. And again, we can't emphasize enough the importance of getting yourself vaccinated. You owe it to the community. And if you get vaccinated, you limit the spread to your loved ones, to your community, and you owe it to the human race to do so. It's not just your personal well-being. It is the human race at stake here in South Florida in particular, especially for those who cannot be immunized because they're less than 12-year-old or those who have sensitivity to the vaccine themselves.
Yeah, Dr. Stephens, you are echoing what we have heard for months. Let me ask you about this. We are on that incline of the surge that by all accounts from the medical community we're hearing an expectation that it will peak around August 23rd. Is that what you're hearing? And do you and your company and your industry have enough resources, enough staffing, enough supplies to get South Florida through that and over that peak?
Thank you for that question. It's a great question. So yes, the pandemic situation is very fluid. It was first predicted the 29th. Now the latest prediction is the 23rd. The testing positivity has gone down to 1%. The hospitalization has gone down about 1%. However, with COVID, the hospitalization is very prolonged. So while we're seeing the decrease in hospitalization, we see an uptick in ICU admissions and patient needing ventilator care. It is an honor to work with HCA since they are nationally and the supply chain is nationally mobilized. We experienced over 100 capacity in ICU the past couple of weeks. And with HCA resource nationally, we were able to siphon and able to mobilize our resource nationally and make up for those surges that we see in South Florida. So HCA at this juncture is poised to take care of all the patients in South Florida, spending from PPEs, ventilations, medications, and staffing. We do mobilize staff nationally to go to these areas, such as ourselves, to take care of the patients and also to relieve the staff that is now tired from the fourth wave of Delta variant.
Dr. Trish Stephens, it is great information. Great to have you. We know you are so busy these days, and to take time for us, we are grateful for that.
Thanks very much.